She went to bed feeling completely fine. No chest pain, no dizziness, no fear. She said goodnight to her husband, pulled the blanket up, and drifted into sleep. Nothing felt different. Nothing felt wrong. But before sunrise, she was gone. The paramedic described it: a massive heart attack, silent, no struggle, no cry for help, no dramatic final moment, just a body that never woke up. After years in emergency rooms, I can tell you something that shocks families. Many fatal heart attacks and strokes don't begin with chaos. They begin quietly during sleep, when the body is supposed to be resting. Night is not always gentle on the heart. Between 2 a.m. and 6 a.m., your physiology shifts in ways most people never think about. Blood pressure patterns change. Hormones begin to rise. Blood can become slightly more prone to clotting. Heart rhythms slow, then prepare for the surge of morning activity. For older adults, this window can become a period of hidden vulnerability. Now, here is the part that is difficult to hear. The problem was not a dramatic medical catastrophe. It was a series of small, ordinary habits layered into the evening routine. Behaviors that seem harmless. Behaviors people repeat every night without question. A late, heavy dinner, too much fluid before bed, sleeping in conditions that strain the cardiovascular system, breathing disturbances that go unnoticed, medication timing that quietly removes nighttime protection. Everything can look stable on paper, blood pressure controlled, cholesterol managed. Yet 1 or 2 bedtime mistakes tip the balance when the body enters its most delicate hours. In this discussion, we'll walk through 5 common nighttime mistakes linked to increased risk of heart attacks and strokes in seniors. We will move from the least dangerous to the most critical. Stay with me, because the number 1 mistake is something I still see almost every week, and many people believe it is perfectly safe. Before we begin, let me ask you something personal. How old are you right now? Take a second and think about it. Age is not just a number in this conversation. It changes how your heart responds to stress, sleep, digestion, hydration, and medication. The strategies that worked at 40 may not protect you at 70. Now, let us begin with mistake number 5. Mistake number 5. Eating a heavy meal too close to bedtime. This habit is incredibly common, and it often hides behind good intentions. Many people believe that as long as dinner is healthy, timing does not matter. But when it comes to cardiovascular stress, when you eat can be just as important as what you eat. When you consume a large meal, your body redirects blood flow toward the digestive system. The stomach and intestines require substantial oxygen and energy to break down food. To supply that demand, your heart must pump harder, pushing extra blood into the gut. During the daytime, this is usually well tolerated. You are upright, you are moving, your metabolism is active. But when you lie down shortly after a heavy meal, things change. Digestion continues at full speed. Heart rate may remain elevated. The nervous system stays more activated than it should at night. Instead of entering a calm, restorative state, the body remains partially in work mode. One of the most immediate consequences is acid reflux. When you lie flat with a full stomach, stomach acid can more easily travel upward. In younger adults, this may cause discomfort. In older adults, it can do more than disturb sleep. Reflux episodes can trigger spikes in heart rate. They can provoke rhythm disturbances in susceptible individuals. They can fragment sleep architecture, preventing the deep stages where cardiovascular recovery occurs. But reflux is only part of the picture. Nighttime is when blood pressure is supposed to dip. This natural decline reduces mechanical stress on artery walls and allows the heart to rest. When digestion remains highly active late into the evening, this dipping effect may be blunted. Instead of falling, blood pressure can remain elevated. For seniors with hypertension, this pattern is particularly concerning. Persistently high nighttime blood pressure has been associated with accelerated vascular damage and greater risk of stroke and heart attack. What makes this mistake so deceptive is that it does not feel dangerous. There is no alarm bell, no immediate crisis, just a body working overtime when it should be repairing itself. The solution is refreshingly simple, yet rarely emphasized. Aim to finish your last substantial meal at least 3 hours before bedtime. If hunger appears later, choose something light and easy to digest. A small portion of protein, a few nuts, something that does not demand an intense digestive response. Your heart needs nighttime to recover, not to compete with a fully engaged digestive system. And while late eating places strain on the cardiovascular system, the next mistake introduces a different kind of nighttime stress, one that repeatedly jolts the body out of its most restorative state. Mistake number 4. Drinking too much water right before sleep. Hydration is essential. There is no debate about that. But timing matters. When large volumes of fluid are consumed shortly before bed, the most obvious consequence is frequent nighttime urination. Many older adults accept this as normal aging. They wake once, twice, sometimes 4 or 5 times each night. Each awakening fractures sleep. Each trip to the bathroom requires the cardiovascular system to shift abruptly from a resting state to an active one. When you stand up from lying down, blood pressure regulation mechanisms must rapidly adjust to maintain blood flow to the brain. In younger individuals, this transition is smooth. In older adults, it may be less stable. Sudden changes can produce dizziness. They can provoke blood pressure spikes. They can increase the risk of falls. But beyond fall risk, repeated awakenings place subtle yet persistent strain on the heart. Deep sleep stages, which are critical for autonomic balance and cardiovascular repair, become shorter and more fragmented. The body never fully settles. Instead of a long, uninterrupted recovery period, the night becomes a cycle of sleep, arousal, movement, and physiological activation. A smarter strategy is to distribute fluid intake earlier in the day. Hydrate generously through the morning and afternoon, then gradually taper as evening approaches. If medications require water at night, use only what is necessary to swallow them. This allows the kidneys, the brain, and the heart to experience longer periods of uninterrupted rest. Now, if disrupted sleep and blood pressure fluctuations are concerning, the next mistake affects the cardiovascular system in a quieter but equally important way. Mistake number 3: sleeping in an environment that is too warm. Sleep is not just about closing your eyes. It is a carefully orchestrated biological process. One of the key transitions involves a drop in core body temperature. This cooling signals the brain to deepen sleep, slow heart rate, and lower blood pressure. When the bedroom is excessively warm, the body struggles to release heat. Instead of smoothly descending into deeper stages, the system works to regulate temperature. Heart rate may remain slightly elevated. Sleep can become lighter and more fragmented. For seniors with hypertension, this pattern is particularly concerning. Persistently high nighttime blood pressure has been associated with accelerated vascular damage. This also leads to a greater risk of stroke and heart attack. What makes this mistake so deceptive is that it does not feel dangerous. There is no alarm bell, no immediate crisis, just a body working overtime when it should be repairing itself. The solution is refreshingly simple, yet rarely emphasized. Aim to finish your last substantial meal at least 3 hours before bedtime. If hunger appears later, choose something light and easy to digest, a small portion of protein, a few nuts, something that does not demand an intense digestive response. Your heart needs nighttime to recover, not to compete with a fully engaged digestive system. While late eating places strain on the cardiovascular system, the next mistake introduces a different kind of nighttime stress, one that repeatedly jolts the body out of its most restorative state. Mistake number 4, drinking too much water right before sleep. Hydration is essential. There is no debate about that, but timing matters. When large volumes of fluid are consumed shortly before bed, the most obvious consequence is frequent nighttime urination. Many older adults accept this as normal aging. They wake once, twice, sometimes 4 or 5 times each night. Each awakening fractures sleep. Each trip to the bathroom requires the cardiovascular system to shift abruptly from a resting state to an active run. When you stand up from lying down, blood pressure regulation mechanisms must rapidly adjust to maintain blood flow to the brain. In younger individuals, this transition is smooth. In older adults, it may be less stable. Sudden changes can produce dizziness. They can provoke blood pressure spikes. They can increase the risk of falls. But beyond fall risk, repeated awakenings place subtle yet persistent strain on the heart. Deep sleep stages, which are critical for autonomic balance and cardiovascular repair, become shorter and more fragmented. The body never fully settles. Instead of a long, uninterrupted recovery period, the night becomes a cycle of sleep, arousal, movement, and physiological activation. A smarter strategy is to distribute fluid intake earlier in the day. Hydrate generously through the morning and afternoon. Then gradually taper as evening approaches. If medications require water at night, use only what is necessary to swallow them. This allows the kidneys, the brain, and the heart to experience longer periods of uninterrupted rest. Now, if disrupted sleep and blood pressure fluctuations are concerning, the next mistake affects the cardiovascular system in a quieter but equally important way. Mistake number 3, sleeping in an environment that is too warm. Sleep is not just about closing your eyes. It is a carefully orchestrated biological process. One of the key transitions involves a drop in core body temperature. This cooling signals the brain to deepen sleep, slow heart rate, and lower blood pressure. When the bedroom is excessively warm, the body struggles to release heat. Instead of smoothly descending into deeper stages, the system works to regulate temperature. Heart rate may remain slightly elevated. Sleep can become lighter and more fragmented. For seniors, this challenge is amplified. Aging reduces the efficiency of temperature regulation. Sweat responses may be diminished. Sensitivity to overheating may decline. A room that feels comfortable can still impose physiological stress. The heart, once again, is denied its most restorative conditions. Creating a cooler sleep environment supports healthier blood pressure patterns, more stable heart rhythms, and better sleep quality. Breathable fabrics, lighter bedding, and moderate room temperatures can make a meaningful difference. But even a perfect room and ideal hydration cannot fully protect the heart if breathing itself becomes compromised during sleep. Mistake number 2: sleeping in a position that interferes with proper breathing. Most people rarely think about how they sleep. We choose a pillow, pull up the blanket, turn onto a familiar side or onto the back, and drift off without a second thought. But for older adults, sleep position can quietly influence oxygen levels, heart rhythm stability, and even stroke risk. Let's start with a simple reality of human anatomy. When you lie flat on your back, gravity pulls the tongue and the soft tissues of the throat backward. In many individuals, especially those with age-related muscle relaxation or excess tissue around the airway, this partially narrows the breathing passage. In others, it can collapse enough to repeatedly block airflow. This is the foundation of obstructive sleep apnea. During these episodes, breathing briefly stops, oxygen levels drop, the brain senses danger and triggers a microarousal. The person may not fully wake, may not remember anything, yet the body is shaken out of deep sleep dozens of times per hour. Now consider what that means for the cardiovascular system. Each breathing pause is a stress event. Oxygen falls, adrenaline surges, heart rate fluctuates, blood pressure spikes. Instead of a calm, restorative night, the heart experiences a repeating cycle of deprivation and alarm. Research shows that moderate to severe sleep apnea is associated with higher risks of hypertension, atrial fibrillation, heart failure, stroke, and sudden cardiac death. What makes this particularly dangerous in seniors is how easily the warning signs are dismissed. Loud snoring is often treated as a joke. Morning headaches are blamed on sleeping wrong. Daytime fatigue is attributed to aging. But chronic exhaustion is not normal. Neither are waking with dry mouth, choking, or irregular breathing. Sleep apnea is not merely a sleep disorder. It is a cardiovascular disorder that manifests during sleep. Beyond apnea, even less dramatic breathing interference can matter. Sleeping flat may worsen reflux, triggering nighttime arousals. Poor neck support may restrict airflow. Nasal congestion with back sleeping may increase resistance. Small mechanical factors accumulate. The practical steps here are surprisingly accessible. First, consider side sleeping. Avoiding back sleeping reduces airway collapse. The tongue is less likely to fall backward. Breathing often becomes smoother. Oxygen stability improves. Second, gentle elevation. Raising the head of the bed slightly or using a supportive wedge pillow can help maintain airway openness and reduce reflux-related disturbances. Even modest elevation can influence nighttime breathing dynamics. Third, pay attention to red flags. If snoring is loud and persistent, if sleep is unrefreshing despite adequate duration, if there are witnessed pauses in breathing, a sleep evaluation is not optional, it is protective medicine. Modern sleep studies can be done in specialized labs or, in many regions, with validated home testing devices. Treatments range from CPAP therapy to oral appliances and targeted lifestyle adjustments. The key message is this: your brain and heart require a steady, uninterrupted supply of oxygen all night long. Any condition that repeatedly interrupts that supply transforms sleep from a healing state into a hidden stressor. And while breathing disturbances are serious, the final mistake we must discuss is the one researchers increasingly describe as the most preventable trigger of nighttime cardiovascular events. Mistake number 1: taking blood pressure medication at the wrong time of day. This topic surprises many patients because medication routines often become automatic. A pill is prescribed once daily, and without detailed guidance, it is commonly taken in the morning. Morning feels logical. You wake up, you eat breakfast, you take your medications. Routine established. Decision never revisited. But blood pressure is not static across 24 hours. It follows a circadian rhythm. In healthy physiology, blood pressure rises before waking, preparing the body for daytime activity. It remains relatively higher during waking hours. Then, during sleep, it dips, typically by about 10 to 20%. This nighttime dip is essential. It reduces strain on artery walls. It lowers cardiac workload. It allows vascular repair processes to function optimally. However, many older adults develop a non-dipping pattern where blood pressure fails to decline adequately at night. This abnormal rhythm has been linked to higher risks of stroke, heart attack, kidney damage, and overall cardiovascular mortality. Here is where medication timing enters the picture. When antihypertensive drugs are taken in the morning, their peak effect often occurs during daytime hours, precisely when blood pressure is already being moderated by movement, posture changes, and daily activity. By late night, the drug's potency may be reduced. The period of greatest physiological vulnerability, the early morning hours before waking, may be the least protected. Several chronotherapy studies have examined this issue, exploring whether bedtime dosing better aligns medication action with the body's risk patterns. Some trials have reported that taking certain blood pressure medications at night improved nocturnal pressure control and restored healthier dipping patterns. Better dipping means less nighttime vascular stress, more stable cardiac workload, potential reduction in early morning events. But this is where caution becomes critical. Not all medications behave the same way. Some drugs are specifically designed for morning use. Others may increase nighttime urination, dizziness, or fall risk if taken too late. Individual health conditions, kidney function, heart rhythm disorders, diabetes, autonomic instability, all influence what timing is appropriate. This is not a one-size-fits-all decision. It is a doctor-guided adjustment. The danger lies in two extremes: blindly assuming morning is always best, or changing dosing schedules without medical supervision. The wise path is a conversation. Ask your physician, is my current medication timing optimal for nighttime blood pressure control? In some cases, the answer will be yes. Keep things exactly as they are. In others, a carefully planned shift may improve nocturnal protection. What matters most is awareness, because when blood pressure remains elevated through the night, the heart and brain endure continuous mechanical stress during hours meant for recovery. And when protection fades at the wrong time, vulnerability rises when you are least able to sense it. So let's briefly step back and look at the full picture we have built. 5 seemingly ordinary habits: eating too close to bedtime, drinking excessive fluids late at night, sleeping in overheated environments, ignoring breathing compromising positions, overlooking medication timing. None of these feel dramatic, yet each one can subtly influence blood pressure, heart rhythm stability, oxygen delivery, and vascular stress during the most delicate hours of the day. The encouraging truth is that these are modifiable risks, no expensive procedure required. No complex technology necessary. Just small, deliberate changes. Better timing, better environment, better awareness. Because your heart does not rest simply because you are asleep. It continues beating, continuously adapting, continuously responding to the conditions you create before bed. Treat the night as therapy, not just habit. Let's go deeper, because understanding why these nighttime patterns matter can completely change how you view your evening routine. Sleep is not passive shutdown. It is an active biological state where the brain, blood vessels, and heart move through carefully timed phases of repair, recalibration, and regulation. During healthy, deep sleep, heart rate slows, blood pressure dips, stress hormone output decreases, inflammation markers decline, vascular tone stabilizes. This is when microscopic damage accumulated during the day begins to heal. But when sleep becomes fragmented, overheated, chemically disrupted, or physiologically stressed, the opposite can occur. Instead of repair, the body experiences low-grade strain. Instead of dipping blood pressure, pressure may remain elevated. Instead of autonomic balance, the nervous system oscillates between calm and alarm. For seniors, these shifts are not trivial. Aging cardiovascular systems are less resilient to repeated fluctuations. Arteries are stiffer. Baroreceptor sensitivity is reduced. Recovery from stress surges is slower. What might be tolerated at 35 becomes consequential at 75. Now consider what happens when multiple small stressors stack together in the same night. A late heavy dinner keeps digestion active. Excess fluid triggers repeated awakenings. A warm room raises heart rate. Airway collapse lowers oxygen. Blood pressure medication peaks at the wrong time. Individually, each factor may appear mild. Together, they form a physiological storm. This stacking effect is one of the least discussed realities in preventive cardiology. Risk is rarely created by a single dramatic error. It is created by layers of minor, repeated strain applied night after night. And here is what makes nighttime risk uniquely dangerous. You are unconscious. There is no early warning perception, no conscious adjustment, no something feels wrong moment. Blood pressure can surge, heart rhythm can destabilize, oxygen can fall silently. This is why so many families say the same haunting words. She was fine when she went to bed. Now, let's talk about a subtle but powerful concept: nocturnal blood pressure behavior. Most people focus only on daytime readings taken in clinics, but research increasingly shows that nighttime blood pressure may be an even stronger predictor of cardiovascular outcomes. Why? Because nighttime pressure reflects how well the cardiovascular system truly relaxes. A heart that never experiences a pressure dip never fully rests. Constant pressure against arterial walls accelerates endothelial damage, plaque instability, microvascular injury, stroke risk. This is where evening behaviors become critical regulators. Late meals, blunt dipping, poor sleep elevate pressure. Apnea, spike pressure. Heat stress, raise heart rate. Improper medication timing, reduce protection. Night becomes a battleground instead of a recovery window. Now, let's address another overlooked issue: sleep quality versus sleep duration. Many seniors proudly say, "I sleep 8 hours." But how many of those hours are truly restorative? If sleep is repeatedly interrupted by bathroom trips, reflux episodes, breathing pauses, overheating, pain-related awakenings, the body may never reach sufficient deep sleep stages. You can be in bed for 8 hours and still deprive your heart of recovery. Poor sleep quality has been associated with higher inflammatory markers, increased insulin resistance, elevated nighttime cortisol, greater hypertension risk, higher incidence of cardiac events. Sleep is not counted in hours alone. It is measured in physiological depth. Now, let's translate everything we've discussed into practical, real-world adjustments. Not perfection, not rigidity, just smarter patterns. Evening meal strategy. Eat earlier when possible. Reduce portion size at night. Emphasize lighter digestion. Avoid lying down immediately after eating. Your digestive system and heart stop competing for resources. Fluid timing strategy. Hydrate consistently through the day. Gradually taper after late afternoon. Limit large volumes close to bed. Sleep becomes more continuous. Blood pressure fluctuations decrease. Sleep environment strategy. Maintain moderate room temperature. Use breathable fabrics. Adjust layers rather than air temperature. Thermal stress declines. Heart rate stabilizes. Breathing protection strategy. Watch for apnea warning signs. Consider side sleeping. Elevate slightly if needed. Seek evaluation when red flags appear. Oxygen delivery becomes more stable. Medication awareness strategy. Review schedules with your physician. Ask specifically about nighttime protection. Avoid self-adjustments. Treatment aligns with circadian physiology. None of this requires dramatic lifestyle overhaul. It requires awareness, because awareness transforms routine into prevention. Now, I want to address something emotional but important. Many seniors quietly carry a sense of inevitability about heart attacks and strokes. It's just age. It runs in my family. What can you do at this point? But while aging cannot be stopped, vulnerability can often be reduced, not eliminated, reduced, and reduction matters. Small decreases in nightly cardiovascular strain, compounded over months and years, can translate into meaningful differences in stroke probability, heart failure, progression, arrhythmia burden, cognitive preservation, overall longevity. Prevention at 70 is not futile. It is strategic, because the goal is not immortality. The goal is more mornings, more conversations, more independence, more ordinary days that quietly become precious. When you understand that risk accumulates silently, especially at night, you begin to see bedtime not as a simple ending to the day, but as a critical preparation phase for survival and recovery. The hours between midnight and sunrise are not empty time. They are biologically decisive, and the habits you carry into those hours matter more than most people realize.